Hi, everybody. This is Dr. Cheryl Schmidt from Vital Chiropractic, and thank you for joining us here today again on a glorious Monday. It is like summertime outside today. I don't know if you know this, Tiffany, because you're not here yet, but it's like 67, 68 degrees, I think, in Mount Vernon right now. It's beautiful, sunny weather, and I'm in like a tank top. So, summer is right around the corner. We have Dr. Tiffany Freeman with us today, and she's going to come and share some information about herbal remedies, specifically for children, although I know that you do all ages. So we can touch on maybe some pregnancy things too as well.
For sure.
I'm going to do clinical practice. She is also an instructor, author, and educator. She is the co-founder and co-director of the Lodgepole School of Holistic Studies in Calgary, Alberta. She's teaching a variety of courses in traditional Chinese medicine, Western herbology, assessment techniques, and Wild Rose College of Natural Healing curriculum. Tiffany graduated from the Wild Rose College of Natural Healing in 2004 with a diploma in clinical herbology. There she was grateful to have mentored under Dr. Terry Willard, who's a PhD, and to be an instructor at the college from 2004 to 2011. In 2009, she obtained her Doctors of Traditional Chinese Medicine diploma from the Calgary College of Traditional Chinese Medicine and Acupuncture and her Alberta Acupuncture licensure. She is a professional member of the American Herbalist Guild, the Alberta Association of Traditional Chinese Medicine Doctors, and the College and Association of Acupuncturists of Alberta. In clinical practice, her passion lies in traditional medicine and therapies that connect us to a deeper healing. She is always learning and studying adjunctive therapies to better provide for her patients' needs. Currently, she is studying the art of orthobionomy. In the clinic, her primary focus is on Eastern and Western herbal preparations with Master, and I hope I say this wrong, Tung Ching Chang's acupuncture and therapies. Tung's acupuncture points are often referred to as magic, as they provide effective and quick relief with a minimal amount of needles, with techniques that are grounded in classical Chinese medicine. And Tiffany incorporates her cultural and traditional values as a person of Cree First Nations descent with her studies and practice of traditional Chinese and Western herbal medicine to create a holistic healing experience for her patients. She is an educator, practitioner, mother of two, and an avid admirer of nature. So thank you, Tiffany. That is quite the list of accomplishments that you have had.
Thanks so much, Cheryl.
A mom on top of it all. So great. I am so excited to have you here to talk about herbal remedies in children. When I asked you a few questions, you talked about how you really like to support the innate healing abilities of people, and that is a cornerstone of the philosophy of chiropractic, as we all have this amazing inborn innate healing ability to grow and to flourish and to develop, and we both have that in common, that we are trying to support that in our patients and in their families. So first of all, I want to just have you add anything that you wanted to add that we didn't talk about, and just tell me a little bit about herbal remedies in children. Where do we start?
Well, thank you, first of all. Thanks for having me. This is really great. It's the foundation of Chinese medicine. We talk about our roots and our beginning. So how we are born, it really, really affects the health and constitution of that child. So it's at the time of conception when the parents have got together and the child is conceived is when we develop that initial part of what we're going to be carrying with us for the rest of our lives. Now that also becomes supplemented through our life through things like good nutrition, environment that we're in, whether that's a healthy emotional environment, healthy spiritual environment you could add in there, and also the environment in terms of potential chemicals or things that we encounter that may create toxicity within inside the body as well. So pediatrics really goes back to where all of us came from that very beginning aspects. And also the health of our parents is really combined in that. So at that time of conception, as I mentioned, the energy, we say in Chinese medicine, we call it qi, that comes from the heaven, our pre-heaven chi, comes to us from both aspects of our parents. So we can think of that in terms of Western medicine as our genetics, that we're acquiring this DNA from our parents. In Chinese medicine, we take that to the next level and we say, well, this impacts more than just potential diseases that you may have, or other genetics that affect the color of your hair or eyes or your appearances. So it's that essence of our health that gets established at that very beginning time. So for me personally, my practice organically has evolved to women and children. I'm not sure how that actually happened. I naturally went into that area where I felt very comfortable. I started helping moms with their pregnancies, and I've helped birthing as well. I've been at some live births as well, which has been really amazing experience. And then naturally just goes to those moms bring their children. So that was my initial introduction to that. And then later is developed, of course, having my own children and then having to be on the spot. As a herbalist, you're really put to the challenge. The first response as a parent, I find, and I know this from talking to my other patients and friends, is we kind of panic. Yeah. We go, my kid is sick. What am I going to do? And as a herbalist, you tend to, or a Chinese medicine doctor, or a chiro probably as well too, you kind of are a naturopath. Even as a medical doctor, you might just kind of go, all that information that you know inside of you just goes this way. Yeah. So for me, it's really been about grounding myself back into, okay, you know this. Okay, it's just this. And also it's been about educating others about when that feeling inside of you, that intuition is telling you that something isn't right, to act upon it, to go and to seek assistance from someone else. And in Canada, of course, we have socialized medical care. And so it's easy for most people, most parents, to access an emergency room without being in a significant debt. So that is beneficial for, most parents here, that they can just go to the emergency room, even if they're like, the doctor turns them away and says, oh, well, that's, that was nothing.
Yeah, just for peace of mind more than anything.
Yeah. Mm-hmm.
It's funny because a lot of the things that you just talked about are things that I am very congruent with in my practice and how I became a provider to work with women and children and babies. And it's not because, I love that population. I love taking care of them, but it's really because of the effect. And like you said, early on, preconception is really where you want to start working with people to create a healthy foundation and a healthy start for the baby to be born into. It doesn't start when you're 20 or 30 or 40 or 60 years old. Mm-hmm. You can do a lot of things to help people then, but really the big effect of long-term health is creating a good foundation. And now you talk about genetics, and there's all this talk about epigenetics and how the environment plays a huge role in our diet. Mm-hmm. And in chiropractic, we talk about the 3 T's: thoughts, traumas, and toxins, and how they affect your body and how you will be healthy, basically, and how your body will function from then on. So, so all this just rings true to me. So when it comes to herbal remedies for children or for pregnancy, what are some of the big questions that you get from people?
First off is I think about safety. People are unsure as to what types of remedies to take and whether that's going to be safe for them. Especially during pregnancy, people tend to be quite obviously wary about what they're taking. And, rightly so. There are big consequences to taking potentially the wrong things. Yeah. And, you want to have a healthy pregnancy. You don't want to have an unhealthy pregnancy or a, premature birth. So we take into precaution, what kinds of things that we're giving to the patients. That's usually almost always the initial questions was, okay, this is my concern. Is this going to be good for me? When can I start taking that? And it's also a lot about weeding through conflicting information with Google, and there's so many different opinions out there as to, for example, red raspberry leaf tea, I think being one of the most significant herbs that's used in obstetrics. When is it safe to take it? There's so much conflicting information. is this needle acupuncture point, is this pressure point safe during pregnancy? So that safety is always the biggest issue. And with children too, I think dosage also is a really important area. They don't understand dosage. They also worry that their children won't be able to take them. So that's the other question is, well, how can I actually administer herbs to my children?
Yeah, because in reality, some of them don't taste all that wonderful. I know I've taken some Chinese herbs in the past, and they don't always taste great. Some of those teas don't taste great. So I can see that as a hurdle. Even when I do some supplementation, but I do refer out for homeopathy and herbal remedies and things like that. And even with supplementation, sometimes it's hard to find something that a child will even let you put in their mouth. So
it's true. A lot of it starts with early education and in adapting their palate, right? I mean, my one son is an incredibly picky eater, my youngest one, but he will take almost any herbal supplement that I give him. And it can be, I think at one point he had a infection, like sinus infection going on, and I gave him a drop dose of this locally grown, farm-grown, sustainable golden seal, and he went, just one drop. And he'd be like, oh, I like the way that tasted. And I know most adults would not put that on their mouth and be happy about it. So I do believe that sort of getting their palate adjusted to flavors. Yeah. And then, of course, masking. Masking is really important for them. Glycerites are really wonderful for that because they have a sweetness to them. Yeah. So buying pre-made glycerites or making your own glycerite of echinacea or elderberry syrup, that's a huge hit at our house. So yeah, that's very commonly used around here too. A lot of people make their own elderberry syrup in my circle of people. So yeah, it's pretty commonly used, and it does taste pretty good for most kids. Yeah.
How about effectiveness? Do people ever wonder about effectiveness? Because they say, well, I can take this medication because they believe that the medication is going to be more effective, but they're not so sure that a herbal remedy is going to be as effective. What do you say to those?
I find it often in conditions where it's chronic. Something like eczema would be a really good example. That in that particular case, I think parents are always wary about whether or not the medication is going to be as effective as, say, taking a steroid initially. Later on, I think after they've had experiences with the steroid, they realize that it worked for a short period of time and now it's not working anymore. For a lot of parents, that's their common complaint. And so they'll do the steroid first and then they'll come back to the herbs and go, okay, well, let's try that. So yeah, I think that they have reservations when it comes to, how effective those herbs are going to be. And people are there's also an element of fear when it comes to it too. So an example would be treating bigger things with herbs or trusting someone to treat something that's a little bit bigger, like strep throat, for example. We immediately go to, well, our fear of scarlet fever becomes really high. Instead of treating maybe initially what was going on in the throat, obviously you want to have a diagnosis. For most people, I think that's important. And in most areas, I think it's also a legal issue as well, too. As practitioner, I know in Canada, our legality, it's very different. We have to have a medical doctor who has given the initial diagnosis. Okay. We're not, what's the term? Considered to be a part of their primary health care provider. Yeah. So, I think that the effectiveness is a big issue for people. And it's the trust that it's going to be effective more than anything. Yeah,
I can see that. People are raised. I feel like people are raised in an environment where they rely on what people telling them what to do and what to take and how things should be, and a little less trust on their own intuition and their own ability to heal. And I assume with herbal remedies, I know with chiropractic care, healing takes time. And with medicine, a lot of times people want a quick fix. They want to know that it's working. They want it to work really, really quickly. So do you see that as well as the herbal remedies, that sometimes you have to work with people and their whole paradigm of healing and health and teaching them that it's going to take some more time because your body has to heal from within. It has to heal itself. And this is an augmentation to your healing, but it's not covering up symptoms. So how do you?
Yeah, I definitely see that. It's, how would I explain it? Yeah, it's something that I encounter quite often, that people really want it to be that the resolution to their problem is right away. And that goes even beyond children. I think for children, we become quite, we feel that it's more serious in a lot of ways. Adults will live with more chronic illnesses. They'll continue to let things linger for a long period of time. The beauty about working with children is that they typically recover way faster than adults. So on average, you see quicker results when you're working with kids. A part of Chinese philosophy on pediatrics is that although children have what they call an innate deficiency of the qi, or energies of the body, which support the immune system, that support the digestive system, those things are weakened until, well, not weakened, I think that's a poor choice of word. They're not as secured as they are when you're an adult. And by the time that they're 6 or 7, that becomes more secured. But the benefit of that, in a way, is that they get over things much more quickly. Yeah. Their body is more efficient at dealing with it. We don't have to give them as much as well. We don't have to treat them for as long with herbs or any other treatment, because they respond a lot quicker to remedies. So in that way, it gives, I think, people the confidence that, okay, once I've chosen this route, I'm seeing results that probably are quicker than if I was an adult. So I try to put them in that perspective, or at least to the parents. I say, like, hey, look, this isn't going to take as long as if you were, in your, 40s or 50s. This is going to be quicker, but you still need to have patience and trust as well.
Yeah, it's so interesting to me how the philosophy and the things that we deal with and educate our patients about in chiropractic are almost exactly what you're mentioning. Even the ages, 6 to 7 years of age, because all the neurology is lying down. Like, those are the key years from pre-birth up to 6 to 7 years of age are the key years that you really want to make sure that you are supporting that innate healing ability, because then things start to become more adult-like. They get more ingrained. The patterns are more adapted to that function. So it's just, it's so interesting how nature has these timelines for, say, in a lot of different avenues. So I was going to ask you, so you have, obviously there's so much to learn. There's so many different herbs that are available, so many different remedies that are available. Where is a good place for people to search out either practitioners or information that is reliable?
Yeah, I mean, finding someone who specializes in pediatrics, I think is a good step, in seeing somebody or having a consultation if you're worried about something that's going on with the children. I think it's an area that we as practitioners should be stepping into more. There's not enough information, I think, out there. I know Aviva Ram, who's a medical doctor, herbalist, and midwife. She did a fantastic course that I sat in on the immune system and children's health. So we need more of those resources for parents. It's simple things, and she did a wonderful job in including very simple remedies for people to, get better and treat them at home. And she also added in very important information as to when to call the doctor when you see certain symptoms. Yeah. So there are the resources. I just don't know if they're as accessible as they can be.
Yeah. I know, like, even in this area, we have naturopaths. I know homeopaths, acupuncturists who do some herbal remedies, but someone who specifically just does herbal remedies is hard to find. Most of them are within the acupuncture field, what I feel. So we do have a few people like that, but is that what you find? Mostly acupuncturists are using the herbal remedies, or?
Yeah, I mean, hopefully with introducing this herbal pediatrics course that I'm going to be offering, I really hope that more herbalists will come out and be brave and bold to bring it into their practices and start looking after the young folks in our society. But in terms of acupuncturists, I think that because we have a pediatric training, and that's part of it, is that a lot of our curriculum is focused on acupuncture, of course, but then we get into the philosophy of pediatrics and gynecology and obstetrics. And a lot of herbal education, for example, a lot of the schools that I know of don't add that as a part of their regular curriculum. You do a little bit of like maybe some gynecological stuff and a little bit of herbs, but they don't go directly into herbs for children. And
and I know that most of yours is based on Chinese medicine, correct? But you have Cree background. So do you bring in some herbal remedies from that background as well that's different?
Yes, I do. So I use Western and I use Chinese and I'll use, local herbs here. And I will put them in preparations that are more in the traditional medicine realm. So for kids, I often don't use acupuncture unless they're really brave, and usually till they're over at least 5 years old. I'll use pressure points, or there's little kind of magnets and other things that I can use. And oftentimes I'll just do nutrition and herbal consults for them because they feel more comfortable in that realm. Sorry. My mind's going into so many different areas.
So where did you just learn about the Cree herbal remedies through people that you know, or was there a specific school that you learned that in? Because that's newer to me. I know a lot about the Chinese medicine herbal, but that's interesting and newer.
So my train of thought is back on. It comes from that sort of the teaching. So I spent about 2 decades, just over, I guess it's been 16 years, mentoring in my own cultural traditions through one of our elders, a local elder who also happens to be Cree. I don't actually live in Cree territory or live where my traditional family are. I'm living in Alberta, which is mostly Blackfoot. We're in the Treaty 7 area. So the medicines are a bit different, similar though, very similar. So I learned from a Cree elder, and what I do is I support through prayer and ceremony. And it's a type of very old traditional healing. So we'll go through and work through fears, anxieties that way, picking up what's going on within the body. So it's a more of an energetic type approach to healing, combined with also using some of the Western plants. And the way that we use it, Western in the sense of, not Chinese plants, so the indigenous plants of this area. And a lot of the preparations are actually used more so in like steams, or maybe potentially with smoke, depending on the child and depending on if they've got allergies or irritations, or also the location as well. Some places I can't use smoke in my clinic right now. So we'll use things like steams or topical as well as the other way, rather than taking directly internally. So it's a more spiritual based approach to working with kids.
Awesome. And so you mentioned that you do have a class coming up, and you have one coming up near us, or me, up in Skagit, or I'm in Skagit County, but it's up in Bellingham and Whatcom County. Is that class open for practitioners, public? Who can all do that?
It's open to anyone. It could be a parent, you could be of any modality or background and just have a really interest in learning about herbal pediatrics. The course is going to take us through a mostly Chinese medicine foundation of pediatrics, but we're going to add in a lot of Western herbals, mostly because of the access. So because I do both, Chinese herbals aren't always as accessible to people because they're usually acquired through practitioner, at least they are in Canada. I know there's more freedom in terms of purchasing herbs in the United States.
Yeah, which can be good and bad. Sometimes we don't know what the quality of them are, so that's also an issue.
Yeah, definitely. So it's definitely open for anyone who is interested in learning more about pediatrics. For a parent that wants to start using remedies at home, I don't think it'll be over anybody's head. I'm going to go in through a very basic conversation as to the foundational theories of Chinese medicine. We'll just explain it, and then we'll move on from there, going into different details of different conditions and diseases.
Awesome. And then you're also doing one you just mentioned in your hometown in Calgary coming up too as well. So when's that one coming?
Yeah, so the one in Calgary is April 27th and 28th. So I've separated it up into a couple days, mostly because I'm also going to do some focus on preparation making at the end of that course as well. Yeah, so we're going to do making our own salves for like a chest rub and a couple of tinctures and stuff that people can take home with them.
Yeah. And will you be doing that as well in Bellingham?
We will be talking about it. I don't know if we'll have the time to do all the actual making aspect of it, but we'll most definitely be talking. And I'll be giving parents or practitioners, people who are interested, some ideas of how to make certain formulas and recipes as well that they can walk away with.
Because there is so much in the Pacific Northwest as far as just in our woods and by our lakes and on walks that we can pick and make our own salves. I went on a recent hike with a group that's called Raven's Roots, and it was all about things we have in our Pacific Northwest that we can use for healing salves and tinctures and all kinds of things. And it's amazing how much is around. So, but also then there's this is this plant that you can use the salve for, but this is a different one that's toxic that looks almost the same.
Yeah.
So there definitely is. You want to know what you're doing. You want to make sure you have the right plant.
Absolutely.
You can get into trouble. So
yeah.
So the one in Bellingham is March 31st.
Yes, it is. Yeah.
So
it's 9 to 5.
Is it 1 day or 2 days?
It's just a 1 day. Yeah.
Okay.
Yeah, one full day.
One long day.
Early. Yes, that's right. One long day of pediatrics.
And I believe if anybody is interested in that class, you can get information through Wild Root Botanicals. They have a Facebook page. If you just find Wild Root Botanicals on Facebook, there's an event for Tiffany's class on there. And I think a couple people I already know are signed up or interested in going. So I think that's incredible that you are offering this to people, because there's so many pharmaceuticals out there for kids that don't support their natural healing ability and don't support healing from within and covering symptoms up, and can sometimes cause more problems in the long term, especially for chronic conditions that
Absolutely.
I think so many people are looking for alternatives. And this is one of those things that can definitely help support healing and health for now and in generations to come.
Absolutely. Yeah.
Did you have anything else you wanted to share, or any comments or questions yourself?
Yeah, I just want to encourage people to be brave and have a look at other alternatives. So you mentioned a really great point. There are a lot of chronic conditions out there that children are on medications that potentially can be, have lifelong, repercussions. For example, the continued use or chronic use of, corticosteroids or steroid medication for things like asthma, eczema. Those do have long-term consequences to our health and well-being. So we want to make sure that the children are supported. And a lot of that comes down to working within the diet and nutrition area. So a lot of the class is going to be focused, at least the first half, about really talking about our digestive system and foods. I think in Chinese medicine, we have a very different perspective when it comes to foods that are beneficial for kids. And it actually kind of goes against what we typically want to give to kids. The example would be, carrot sticks and, yogurt cups and things like that are in Chinese medicine, we say are very cold and hard on the digestive system. So a lot of what I'll be doing in the class, and a lot what I do with my patients, is counseling them out of or re-educating them into a different realm of thinking. And they think, well, what can I feed my kids then? And it's like, well, you just have to think outside the box. And it's the same way with choosing to work within a different modality, or to work together with another practitioner and trust that they are going to be helping. And the same thing with the food. That's going to be making a huge difference as well.
Yeah. Yeah. Well, that sounds amazing. Thank you very much for coming on and sharing some information about herbal remedies for kids. I really hope people look into it and get to your class that you have coming up, because, we talked for 30 minutes, but this class that you're doing on March 31st is, I think, from 9 a.m. to 5 p.m.
It is,
so this is just a teeny little smidgen of all the information that you can learn from Tiffany. And she's coming here from Calgary, fellow Canadian. So So yeah, get out there and learn some more about this. And for the practitioners who are watching who want to learn more to help support their patients, they would be a great class to do as well. So thank you very much, Tiffany, for joining us. I hope there's a ton of people at your class on the 31st and also in Calgary. And thank you for everything that you do for moms and babies and dads and families and for the future health of our planet. So
thank you so much, Cheryl. I really appreciate being on with you today. It's great.
You're very welcome. If anybody has any questions, you can leave comments and either Tiffany or I will get back to you and try to answer your questions or find the resources for you. Links to Tiffany's website and also for the school that she teaches at and has founded in Calgary will be available, and I'll link them in the comments as well. Thank you all for joining us. And
thank you, everyone.
See you again soon.
Okay.
Bye.
Bye.